team up here. Okay, good afternoon. I think we'll go ahead and get started, and I think I'll state the obvious. Again, this is an unprecedented time for our state and our nation. Within the course of 1 week, we've learned of the first positive cases of COVID-19 in Iowans, identified community spread, implemented mitigation strategies, including school closures, to protect the health and safety of all Iowans. We are monitoring the situation in real time and making evidence-based decisions to mitigate and slow the spread of the virus. Our efforts are focused on preventing a sudden spike in positive cases that could overwhelm our healthcare system and cause other significant impact to the state. Last night, I recommended that Iowa schools close for 4 weeks. This recommendation is driven by evidence-based guidelines from our federal partners at the CDC, as well as just great coordination with the Iowa Department of Public Health. We know that our children are generally less affected by COVID-19 than others. However, they can carry the virus, spreading it in the community. We also have teachers and staff working in our schools who are older adults and others, including children, with underlying health conditions that would put them at risk. These variables, along with community spread metrics, were important factors in our decision-making process. Other substantial community spread was confirmed. It was time for the next phase of response and mitigation. We know that closing schools has a ripple effect for Iowa families, businesses, and our workforce, and I understand that many families are concerned about how to care for their children and continue to go to work. Child care plays a key role in supporting Iowa's ability to continue essential functions. My staff is working hand in hand with the Department of Education, the Department of Human Services, and the Department of Public Health to put policies in place that ensure continued access to child care during this time. And this includes financial assistance so that child care providers who receive child care assistance are paid on enrollment rather than attendance, and ways to expedite licensing so that we can quickly ramp up child care capacity. Many low-income families who rely on meal programs in their schools are worried about how they will feed their children at home. Iowa has already applied for and received a USDA waiver to allow schools to continue serving meals upon closure. Schools will be able to activate their summer meal programs and provide meals in non-group settings such as drive-through pickup or a grab-and-go. The Department of Education is working with school districts now on these details, and schools will provide more information to families soon. The legislature will be considering, and I will sign if passed, legislation to waive the instructional time requirement for any time missed while schools are temporarily closed during the next 4 weeks are temporarily closed until April 12th of 2020. That legislation will also provide me the authority to waive this requirement for a longer period of time if we determine that that becomes necessary. Today, the Department of Public Health has confirmed 1 additional positive case of COVID-19 in a resident of Dallas County. The number of positive cases of COVID-19 is increasing across the country, and the same will occur here, especially now that we have confirmed substantial community spread. Today, a second shift is being added to the State Hygienic Lab to expand our testing capabilities. Our daily capacity for running tests will now increase from 54 to 108 tests per day. When the situation warrants, we are ready at that point to add a third shift so that we can run tests around the clock. National labs have also begun running tests from Iowa, and these labs are required to report all positive test results to the Iowa State Hygienic Lab, and those numbers will be included in our daily updates. However, we will not know the number of Iowa tests pending at the national lab or the number of negative test results. Because the information available to the State Hygienic Lab and the Department of Public Health is now changing, We will continue to report our positive cases and the county of residents, but we will no longer be able to provide information regarding any known risk factors or contact information related to the positive cases. Today has been another very full day here at the State Emergency Operations Center. This morning I held a meeting with all state agency directors where I was updated on their mitigation plans to protect the Iowans they serve and their operational plans to ensure business continuity. Later, my team met with Iowa's health systems and other provider organizations to discuss their readiness to serve those who will become ill due to COVID-19. I'm encouraged by the one-team approach they are taking together to ensure Iowans will have the care that they need and deserve when the time calls for it. And we're going to continue to work closely with the team and stand ready to assist them with their needs as we move forward. We're continuing to work with other businesses and industries to discuss how the state can help ensure that Iowa remains open for business. Also today, I joined other governors for a call with President Trump as well as Vice President Pence and their team for an update on COVID-19 mitigation efforts at the federal level. The President has met with the grocery industry, and he just assures us that stores will stay open, and he asked that all Americans shop for their weekly needs, allowing stores to keep the items in stock so everyone can purchase essentials for their family. We also had a call with our grocery industry on Saturday, I think it was, and they indicated the same thing. You know, we're coordinating efforts there to make sure that we can get the commodities out to the locations so that Iowans will be served. He also shared that more testing capabilities are being rolled out across the country. President encouraged all Americans to, again, practice social distancing to stay ahead of the curve with the virus. And I'm also calling upon each and every Iowan to be an active part of our statewide mitigation strategy. You really can make a difference. Now is a critical time when we can mitigate and slow the spread of the virus in our state. But it takes all of us working together and to do the right things to make that happen. So I just urge all of you to follow the CDC guidelines and take preventive measures to protect your health as well as the health of others. Wash your hands frequently, cover your coughs, clean frequently touched surfaces daily, avoid crowds. Consider staying home as much as possible, especially if you are a vulnerable population with underlying conditions. Avoid all non-essential air travel and especially cruises. And most importantly, if you are sick, stay home. And call your doctor first before going in for an appointment. They will run you through an assessment and help get you the information that you need. These steps may seem too simple to combat a worldwide pandemic, but they are the most important things that we can do right now to mitigate the virus and to slow its spread in our state. Finally, I know that there is a feeling of uncertainty as the situation continues to unfold, and as I continue to say, we just need to remain calm, we need to stay informed, and please be vigilant about your health and the health of your families, friends, neighbors, and fellow Iowans. And so with that, we will get through this together, and of course I will continue to keep you updated as more information comes in. And with that, we'll go ahead and open it for questions. I will say, because a lot of different areas are being impacted, I have several of my directors of the various agencies with me today. And so if there are specific questions, I may ask them to come to the podium and address your question.
Governor, the President was talking about limiting to groups of 10 or fewer. That impacts obviously so many places like restaurants,
Yep.
gyms, ultimately daycare, all those kind of things. Other governors have already pushed through changes when it comes to restaurants and bars. You haven't gone that far.
Yep.
Is that about to happen?
Well, we're continuing to assess the situation. We're not making that recommendation right now, but I said the same thing with schools. So each day we sit down, and multiple times throughout the day we continue to assess the information that we're receiving. Again, we can address this, and you can do that without me ordering these businesses to close. If you are sick, you have a fever, a cough, any respiratory illness, stay home. Practice social distancing. Once we apply the basic recommendations that the Department of Public Health and CDC is making, we start to have the impact that we're looking for without implementing some of those additional procedures. So I'm not saying we're not. At this point, we are not, but we're going to continue to assess the situation. Hey, I bet they do takeout, so call and order and pick it up and take it home. So there are other things that we can do to support our business and industry to help keep them up and running. But most importantly, again, if you're sick, stay home and practice social distancing.
Governor, on that call with the president today, there was some reporting that about ventilators that he was saying by getting those additional resources yourself. Where does the state stand on ICU beds, ventilators, if people are really experiencing, extreme conditions, critical conditions? And, what are your thoughts on that request from the president?
So I talked about the multiple meetings that we're having with our healthcare providers and really talking about delivering the services from a healthcare ecosystem and network. And part of that is conducting with the providers what resources they have, the supplies that they currently have on hand, and what their projected needs are going forward. We already had started this conversation. We need to be thinking outside of the box, and so we've already tasked a couple of our agencies to reach out to some of our private sector vendors to see if there is an opportunity for us to put in some orders here at home, as well as what we're doing through the what do I call where we're getting the other resources from? Who's going to help me? What's that called? Strategic National Stockpile. Yeah. So we also are placing orders there, but we're also being proactive and looking for opportunities where we can maybe do some of that in our state, and all states are doing that. But in addition to that, we're trying to get a good sense, and we're working on it daily, of what we currently have for supplies, what our anticipated need is, and how we can be proactive in making sure that we can meet the needs of Iowans.
So right now, what we're trying to address is flexibility for districts to not have to meet the instructional time. No, we don't know where the end of this is going to be. With a 4-week waiver, that is certainly going to impact needs for graduates and the requirements of the state. So that flexibility allows us to be proactive, consider what future implications might come into play, and let districts figure out what their other plans might be to address those needs. Yeah, so the waiver of instructional time requirement sort of changes what that conversation would look like and gives us a chance to address this as the situation evolves, and maybe that's a question for you to answer.
Yeah, well, it just gives us more flexibility, but that is a concern right now, and then we have other circumstances that we deal with once we move into summer. But again, this provides some relief through, I think it was April 12th, and then we'll reassess after that. I believe the powers, they have extended some powers to the governor to address that going forward, and we're going to continue to work with the Department of Education as well as our superintendents across the district and continue to assess the situation. But right now, this really gave them, I think, some relief that they were looking for as they try to plan what their next steps are in educating Iowa students.
Back to the ventilators, how many do we actually have? And if we do get into that worst case scenario, are we starting to put together plans of these doctors making difficult decisions when it comes to treatment?
We don't know a number yet. But.
Yeah, so the exact number of ventilators, we continue to reach out and assess sort of ventilator capabilities, higher level of care capabilities, and as the governor said, having conversations with partners throughout the state to talk about how we would work together. Your question about what we would do if we were challenged with those resources, that's a great question, and it's another example of something that public health and clinical partners have been working on, not just for weeks or months, but for years. We've put together plans about how we handle surge capacity, both at the individual facility level and at the state level, as well as at the national level, how we work together and how we prioritize caring and providing the services that we can for patients. But that's all the more reason why it's so important to stay home when you're sick to avoid us, having to overwhelm the healthcare system.
Do we have a copy of that plan?
We do. Do we offer that plan? Yeah, we do have plans. There are some plans through public health preparedness that are actually considered confidential, and I believe this falls under that.
Governor, can you talk about testing? We're hearing from some Iowans that it's taking them a while to get their results, if they have COVID-19 or not. Kind of what's the process? How long does it take? That sort of thing. How many tests are out there?
Yeah, I don't know if I don't know about the number of tests today, so maybe Dr. Badati or Sarah can address that. But within 24 hours, the tests that are going into the state hygienic lab, we're able to provide those results. Well, I should just let you, I don't want to miss, within 24 hours. And as I said in my remarks, we're adding a second shift so that we can almost double the capacity that we'll have to test. And if the need arises, we'll be able to add even more. So the turnaround time is relatively quickly there. Once we go to some of the national lab availability, that's taking a little bit longer to get the results. But today, a conference call with the Vice President and the President, they did address that, and as we're expanding the number of kits and the capacity to do the testing, they also are reducing the time that it takes to get them back. They mentioned 48 hours. I don't think they're there yet, but that's a goal, and they want it to be reduced to even a quicker turnaround time than that. And so I know that's the goal, and every day I think they're having their capacity is growing, and we're making great strides from that perspective too. We know it's really important because the sooner we can get the results back, then we need to take the precautionary steps. Is there anything that they need to be doing in the interim when we're testing? If you're sick and been tested, self-isolate and stay home. I mean, I feel like a broken record, but again, I mean, they need to, if you have any of the symptoms, you call the doctor, you go through the assessment. He makes the determination if you should get a test or not, or come in. If it's determined that you do need to test, then you would need to stay home until we find out what the results are, and then they'll start the additional assessments that they do from that.
Are you planning drive-through testing anytime soon?
We are. That's a priority of mine. We're working on it. There are 10 states that are doing that right now, so we are hoping that we will be able to stand that up. What I learned on the call today, though, is a lot of the drive-through tests are really focused on public health officials, first responders, EMS, our essential services that we need to make sure that we have the workforce in order to take care of Iowans, and then Iowans 65 and older. So there are some parameters in the way that they're standing up the drive-through, but I still think this is something I'm hoping that we're able to move on. And it was, I know, a topic of conversation at the healthcare meeting too. So everybody's looking at it, and hopefully we'll be moving to a couple of those drive-through test opportunities
The state
soon.
auditor has already ordered his employees to work from home starting at least by tomorrow. Are you close to doing a statewide policy?
Every one of the agencies have already implemented that. They're way ahead of that. They're already, Dr. Garcia, would you like to kind of give an update on what you've done? And this is reflective of what we're seeing in some of the other agencies as well.
Certainly. So we thought, being the Health and Human Services Agency, that we should probably set a good example here. We went from being an agency without a telecommuting policy to standing one up. Today, we deployed 500 employees to a work-from-home status, focusing on Dallas County and the surrounding Polk counties. Areas, offices, and by the end of the week, we should be up to 2,500 of our employees. Obviously, we do have some individuals who are in direct care roles who don't have an option to telecommute.
And that, thank you, Director Garcia. And that's reflective of what we're seeing across our state agencies. So they've already implemented those practices, and we'll continue again, like we do throughout the day, continue to reassess how we're delivering services and meeting the expectations of Iowans.
Daycare providers are about to be inundated, and I've also heard that some daycares are actually trying to close down temporarily. What should people be doing? What should these providers be doing to keep their facilities safe? And what advice do you have for parents out there
Yep.
as they are struggling to find care for their children?
Well, I want to talk again about the collaboration between agencies and why it's so important, and why we are kind of co-locating here at the CEOC so that we can have coordinated conversations in regards to issues just like that. And I want to thank the Iowa Department of Public Health, the Department of Education, and the Department of Human Services. I don't care which one of you want to take that. Maybe Kelly, do you want to step up again? And they'll walk through some of the steps that they've already taken in regards to your question.
So I think we have two categories of children here. Children who are not school age and already in care, where their providers may be making the decision to close. We did send out guidance over the weekend in partnership with Department of Education around how best to make that decision. And then we have children who are school age but are affected by school closures, and their before school and after care might have also closed around the school closure as well. And we're working on both issues. So it's important to us because there are risks and benefits to every decision in this time, but the need for childcare during this time doesn't go away. And so we're working with individual providers, we're working with superintendents to stand up alternative sites, particularly, as the governor mentioned, for employees of hospitals, first responders, other essential workers during this time who really can't afford to be away from work. And our goal around that is to really ensure that providers are still able to operate safe childcare settings. Sending children to grandma and grandpa is not a good idea at the moment. And so we'd like to really make sure that we continue to lay eyes on children and really, I mean, again, a broken record, but having parents and providers in childcare settings really hold true to not sending a child if they are ill, and doing scans at the doorway when children are dropped off, really making sure that, of course, hand washing and pristine hygiene at the centers is at the core of their mission. We do that during cold and flu season. We're ramping up our technical assistance on the regulatory side to make sure that childcare providers are staying true to that model. We've also asked the Department of Corrections to help us in our supply of hand sanitizer and cleaning products, and that will be key in this effort.
But if K through 12 kids can't go to school, why should those younger than that, why is it still safe for them to still be going to daycare?
So I think there's a question there about health safety, which Dr. Padati and I have been having extensive conversations around. And then there's a broader impact around economic and child welfare issues. So if children, again, the need for care does not go away, it just gets pushed to a different place. And I know that we've seen, I myself don't have a Facebook account, but we've seen that some individuals are standing up alternative child care sites on Facebook. Again, parents still have a need for care. So it would be our preference, strong preference, that in this time we step in and provide that space, that we social distance as much as possible in those settings, that we provide technical assistance around good hygiene practices, that we hold true to not admitting children who are ill, and we ask parents to keep children home if they have the ability to do that.
The mayor of Miami is testing positive for COVID-19, but has shown absolutely no symptoms. Is perhaps a question for Dr. Padati. So how are we, if we're looking at symptoms and staying home for symptoms, I mean, how can we say that people aren't spreading this disease just like he might have been if he wasn't in quarantine?
Yeah, again, a great question. And overall, I would say it's an example of a place where we do continue to learn more about this illness. I would also say that it's always really important still to think about the person, about the patient and their symptoms and how they feel. You know, tests are great. Sometimes we get false positive tests. Sometimes we get false negative tests. It's really important to think about the person. And I can tell you I was on the phone with CDC as recently as an hour ago, who's reiterated the same thing, that we're going to continue to learn more. We're going to continue to investigate these things. But we really think people are spreading when they're contagious. So again, you know, taking those cues of if you don't feel well, and this I know is hard, but if you don't feel well, even with a mild illness, right? So if it's just a cold for me, it could make somebody else in one of those more vulnerable populations really, really sick. So even if I don't feel super sick, it's important that I sort of isolate myself and stay away from others and keep an eye on how I'm feeling, regardless of whether it's COVID-19 or flu or anything else.
But isn't that, you know, and I understand, but people who are at home and who are watching TV, who are reading newspapers, who are scared, you know, what do you say to their fears, that what example that is?
Yeah, again, I think that's exactly why it's important to remember there's a couple of really good things you can do, and I know they sound simple, but if we think about what we know about viruses like this and this virus, it's somebody who's sick for the most part, who's coughing, right, or sneezing, or droplets are going on to somebody within close contact. And so the more we can do to keep those people away from others and, you know, not allow those opportunities for transmission, the better. And again, the data that we've seen so far is supporting that, you know, this is how we see people, you know, getting sick with this. And I also think, again, going back to the idea that for most people, for about 80% of people, we do think this is a mild illness. And again, I know this is hard, and I know, sometimes we'll say things like, well, it's just a cold, I still feel well enough to go to work. But what we're saying is, even if you feel mildly ill, even if it's, a sore throat or, a mild fever or a cough, we want you to stay away from other people, stay home, stay isolated, and pay attention to those signs of how you feel, regardless of what's making you sick.
We've seen over the weekend that people, despite, raising alarm about not gathering in large spaces, people are going to bars and doing all these things. Tomorrow's St. Patrick's Day. Iowa doesn't have a ban on bars and those sorts of settings. What's your message to Iowans about, it's okay, I can go because I'm young?
Nope, I would say just the opposite. It's the same message I've given throughout this press conference. If you're not feeling well, stay home. If you have a cold, a cough, a fever, any respiratory, anything that Dr. Badati just walked through, you should not be in public. You should stay home. Practice social distancing, so don't cram yourself into some of those venues. You have a role to play in helping us mitigate the spread and to bend the curve. We all have a role to play in this, and one of the biggest things that we can do is to practice those simple guidelines. There will be another St. Patty's Day next year. So just if you're sick, stay home, practice social distancing, wash your hands, cough in your sleeve. If you're not feeling well, call the doctor. They'll go through the assessment. They'll route you and give you the proper recommendations that you need to move forward. And that's, if we all do that, this isn't going to end tomorrow, and we're going to continue to see the numbers rise for a while. But it really will help us bend the curve. It will help us prevent the healthcare system from completely being overburdened and taxed, and it will allow us to serve the most vulnerable Iowans who needs our healthcare professionals serving them. So especially if you're 80 or older and you have underlying conditions, the statistics are scary, and so we need to keep that into consideration. I want to have, and then we'll take questions, but I want to be sure too, because this is another question that we can continue to get, and it's about unemployment and what we've done at the state today, I believe, and I have Director Townsend with me who can give you an update on what they've been able to do from the state perspective in coordination, I think, with the federal government as well. And then I do have Director Dunn is with us today, and I want to thank her. When we talk about telecommuting from home and being able to stand up in the manner in which we've been able to do, she's played a vital role in making that happen, and I really appreciate her really helping us implement a work-from-home strategies in a really relatively short period of time. So with that, I'd like Director Townsend to address unemployment. Beth?
Thank you, Governor Reynolds. Part of alleviating the fear and concerns that we see in our communities with regard to staying home from work were alleviated this morning when the governor announced the initiatives that we have undertaken at Workforce Development to ease the process for filing unemployment claims, to broaden the eligibility group, and to also have a corresponding break for employers who will not be charged for those unemployment claims for individuals that have to take work off because of, for instance, their parents and their children are going to be out of school for a period of time and they don't have backup daycare. They could file an unemployment claim. We have waived the fact-finding interviews. We are waiving the waiting period, and we are waiving the work search and work availability requirements, which means that Iowans can expect to be paid within 7 to 10 days of the time that they file the initial claim. We've seen a pretty significant jump in calls for information today, so the governor put out a press release this morning regarding information for employers and claimants. I would encourage everyone to go to the Iowa Workforce Development webpage. We will continue to update that. We are working with our employers. We have reached out to ABI and to IBC to also coordinate our support for employers. And if there are any employers who have any questions, we are having a webinar tomorrow at noon, and we're having a webinar tomorrow at 1 for claimants, where we will answer questions online and live. We will record those webinars and then post them on our website so that they'll be available in the future for anyone else anyone who's not able to attend the webinars tomorrow.
Thanks, everyone, for your time.
Thank you.
Appreciate it.
Are you going to ask me my age again? I'm a little leery about going back there.
Dallas County, the new case, do you have an
It was community spread. We're still assessing. Yeah, we're still assessing that.
We can follow up afterwards.
Thanks, guys.
Thank
Really
you.
appreciate it.
Thank you.